यो हाम्रो 17 गते भूकम्प गयो सर। 18 गते हाम्रो कार्यालयमा फोन आएको थियो अनि यहाँबाट गएर 7 घण्टा हाराहारी लाग्छ यहाँबाट जान। वहाँ गएर हामीले पहिलो चरणमा 2टा बिरामी उद्धार गरेर ल्याएको अनि ल्याएर प्रदेश अस्पतालमा छोडियो। उहाँको समस्या भनेको यो धारमा चोट लागेको थियो ढुङ्गाले। अनि त्यसपछि हामीले राम्रोसँग उहाँलाई यहाँ लिएर फेरि पछिल्लो लटमा हामी गएको थियौँ। पछिल्लो लटमा जाँदाखेरि पछि फेरि 3टा उद्धार गर्न पायौँ। हामी नलघाट वडा नम्बर 3 चिउरी भन्ने ठाउँबाट ल्याएर आएको। हामी यो 2 वर्ष अगाडि WHO को सहयोगबाट यहाँ अनि स्वास्थ्य निर्देशालयको सहयोगबाट हामीले तालिम ल्याएको थियौँ। कस्तो बिरामीले कस्तो गरी उद्धार गर्नुपर्छ अनि पोइजन खाएको बिरामीले कस्तो अवस्थामा गर्नुपर्छ र हामीले यो धार भाँचेको खुट्टा भाँचेको बिरामीले कस्तो गरी लैजानुपर्छ भनेर उहाँहरूले ल्याउनु भएको थियो क्लासहरू। तालिम पाउँदाखेरि धेरै उद्धारहरू हुँदो रहेछ। अब सिकियो भनौँ। अब पहिला त अब जस्तै छिटो हस्पिटल पुर्याएपछि मात्रै ठिक होला भन्ने हुन्थ्यो। अहिले त अब त्यो नै कि अब बिरामीलाई कुन अवस्थाको बिरामी हुनुहुन्छ त अब हस्पिटल पुग्ने बेलासम्म उहाँको अवस्था के कस्तो छ त कसरी सहज हुन्छ भनेर त्यो हिसाबले फरक परेछ तालिम गरेपछि।
We were the first responders for the earthquake which took place in Kartik 17th in Jajarkot and Rukum. We received the cases as such, 7 cases early in the morning, and then our BEC trained first dispatchers were sent to the earthquake site where they had done the primary survey. As we were trained during our BEC training, we followed the triage method according to which the patients were categorized and treated accordingly. And then when the patients required a much further help, they were transferred to our main hospital in Surkhet, Kalagaon, where they were treated. After triaging, we used the WHO specified case forms and then delivered the management accordingly. During the BEC trainings, we were taught by our international trainers that first and foremost we need to triage the patient. The most helpful part was the standardized clinical forms which was provided as a example to how do we treat the patients and mention their management accordingly. So these forms provided as a very quick and effective method by which we could treat the patients. I would suggest that every health workers who is working in different district hospitals, province hospitals of the country should be trained in it, because you never know who will be the first responder in any case of disaster.